Welcome back. If you've had shortness of breath, chest pain, you're probably fine, but you might have a rare condition, and Dr. Bhuvin, a transplant pulmonologist, is here to tell us more about pulmonary hypertension. It's two long words,
It is.
but this is something that you talk to people about all day. What are some of the signs and symptoms?
Yeah, well, we can start with pulmonary hypertension. It's a big term. It simply means when the pressure in the right side of the heart goes higher, when the artery that connects the right side of the heart to the lung starts seeing higher pressures. Right side of the heart is a weaker side. Eventually it gives out and can lead to right heart failure. That's where pulmonary hypertension term was coined from, pretty straightforward. Signs can be very subtle in the beginning. That's where, it is missed and people don't get diagnosed for a long
And that's why you're here talking about it.
Yeah, our goal at Norton Thoracic is to kind of create this awareness among people to what to look for. There are subtle signs like shortness of breath or cough, dizziness that comes later on, and we don't want to get to that point. We want to find patients before they get to that late stage of pulmonary hypertension. In general, it's a progressive disease if left untreated, and it could lead to death, which is what we want to try to avoid. And there are treatments available for it. If we treat it in early stages, we can control the disease, make it, people have a better and a longer life. In addition, the other symptoms that we see are like just subtle cough sometimes. And as the disease progresses, we can start seeing swelling in the legs and the dizziness that we talked about.
I can see how this would be very hard to diagnose and detect, right?
Yeah.
Because shortness of breath, a lot of conditions might cause that. And so
Right.
this is unusual and does become difficult to diagnose. What are some of the causes?
Yeah, it's a variety of things that can cause pulmonary hypertension. I mean, a lot of people have pulmonary hypertension for no reason. It's called idiopathic. It is divided into 5 major groups. If you look in medical ways, the group 1 is the true pulmonary arterial hypertension, where most of the treatments kind of like focused into. But then there are other groups like group 2 pulmonary hypertension, which is if your left side of your heart is not doing so well, the right side is going to see that pressure. And many people have left heart problems, right? So it's out there, but they don't recognize that they develop pulmonary hypertension along the way. That group happens to be the most common type. There is group 3, where people have lung diseases and they develop pulmonary hypertension with prolonged or advanced lung diseases as well. We see that very commonly as a lung transplant center. And then there is other kind where somebody who had a lot of blood clots during their life that can develop pulmonary hypertension. And then the group 5 is just a mix of other reasons as well. People who have certain conditions at a higher risk for pulmonary hypertension, for example, connective tissue disease like scleroderma or lupus or sort of things, they need to be monitored very closely for development of pulmonary hypertension. As we talked about, people with left heart diseases or lung disease are kind of a high risk, but anybody could get this, rare disease in general. And I think we call it rare, but there's a lot of undiagnosed patients around us, which is where we are trying to make a difference.
Right, you want to get in there before somebody needs a lung transplant.
Exactly. And we have an expertise in lung transplant. We have established one of the most successful and largest lung transplant center in the country over the last 15 years. But our first, job as physicians is to try to prevent patients to get to the lung transplant. We want to treat their disease sooner, get them better, and then if they need transplant, we have expertise for that. But the same expertise we used to start a lung transplant and build a very successful lung transplant program, we are applying the same expertise to treat these rare conditions, pulmonary hypertension or idiopathic pulmonary fibrosis or, LAM, which cystic fibrosis, et cetera, and we have services available for those too.
So as with so many conditions, it's so much easier to treat it when it's detected early. If folks are having some mysterious shortness of breath, some coughing, some pulmonary issues, they should come and see their doctor or you guys.
Yeah, please reach out to us or any pulmonary hypertension expertise center. You need additional diagnostic testings. With us, we have clinical trials, research programs. I'm investigator in certain trials. So is my colleagues that can help get patients, treatments that are sooner than it's even approved or available out there. So we can enroll patients into those things. We have support groups. We have protocols and vigilant monitoring and treatment that's necessary for certain rare conditions. And we treat these patients day in and day out, which allows us the, gain the experience in it and provide the best care.
Thank you so much for being here. Thank you for your expertise, Dr.
Thank you.
B.